Okay, so some of the other symptoms that can occur during this time are like kind of changes in the bladder. So have you been experiencing any problems going to the bathroom?
Well, I'm not going to the bathroom. There's no problem there, but making it to the bathroom is sometimes a little dicey.
Okay, so you feel like you have some urgency.
Yes.
Okay.
Yes, if I have to go, I have to go.
Okay, you need to make it right
Right.
away. Okay. Do you ever wake up in the middle of the night where you feel like you have to run to the bathroom?
I try not to drink a lot before bed, so that doesn't happen.
Okay.
But when I wake up, I have to go.
Okay.
So,
Okay.
but twice a night, please.
Okay, so you wake up twice a night to go. Okay. And when you're waking up, do you feel like you have to rush?
Yes, luckily it's close.
Okay. Well, good. I'm glad your house is designed that way.
That's right.
And have you ever noticed any kind of leakage or just little dribbles when you cough or sneeze?
Yes, I wear a panty liner.
Okay.
Just because it happens.
Okay.
So, or if I don't make it and I have to go right now.
Yeah.
Then I squeeze, but.
Yeah. No, I understand. I understand. Okay. And so if you're like jumping or doing anything like that too, you can get some.
Yes, but I don't do a lot of jumping.
Okay.
But
Okay.
it might happen if I jump.
Okay.
But
I
usually don't
understand.
jump.
Do you ever feel like you can't empty your bladder all the way?
No, it always. That's not a problem.
Okay. Okay. So there are several types of kind of urinary symptoms that can go on. So one of them is overflow incontinence. So incontinence is just that word, just you can't always keep it all in when you want to all the time. So I don't think that you have that. So some of the risk factors for that would be if you had diabetes, or if you had some other neurological condition that kind of affected your sensors on your bladder, basically, to know how full it is and when it needs to go. Okay. So when you tell me that when you sneeze or cough, that you're having some little dribbles or leakage, that's kind of lines up with stress incontinence. Okay. So basically when there's stress, so like when you sneeze or cough or jump, even though we're not doing much jumping, which is okay, your pressure inside your body builds up, and that can kind of force some of that urine out because the muscles around the urethra just aren't as strong as they used to be. And things like childbirth, which you've had 6 children, so that can be a risk factor. Also diabetes, which you don't have, but any other risk factors are being overweight, which you're not, but I think, having the 6 children, that can lead to that. So the other type of incontinence would be like overactive bladder, where your muscles around the bladder just can't relax, so sometimes they're spasming, and that can cause you to feel like you need to rush to the bathroom. So it sounds like you're having kind of a mixed picture of the overactive bladder and the stress incontinence. So we have several options for those things. One of the things we can start with is pelvic floor therapy. So just kind of help strengthen some of those muscles. And then if that doesn't work, we can kind of talk about medications that we could try to kind of help with that. One other question I wanted to ask you, have you noticed any problems with your bowel movements?
Yeah.
Okay. No problems getting to the bathroom with that or any leakage?